Hello, my name is Leslie Tingy, and I am a Block 4 student in the nursing program at Mesa Community College. And for my honors project, I have chosen to research the evidence-based nursing practice of using chlorhexidine gluconate versus povidone-iodine in preoperative skin preparation for reducing surgical site infections. Surgical site infections, or SSIs, are one of the most common complications of surgery. According to the Centers for Disease Control and Prevention, SSIs account for about 20% of all hospital-acquired infections and increase patient stays by nearly 10 days, while the annual cost of surgical site infections is estimated to be around $3.3 billion. Preventing an SSI is an essential component of the broader goal of healthcare, which is to increase patient safety and improve outcomes. One preventative strategy to reducing surgical site infections is preoperative skin antisepsis. Selecting the most effective antiseptic agent is critical in reducing bacteria at the surgical site. In this presentation, I will review the evidence, identify a quality indicator, and relate the findings to the current policy at Honor Health. Additionally, I will discuss the implications for future nursing practice. To provide a framework for my research, I used the PICO question approach. P refers to a specific population to be studied, I relates to the intervention to be performed, C is for the comparison factor in the study, and O considers the outcome of the intervention. There are a couple commonly used aseptic skin preparations used in preoperative skin preparation. The first is chlorhexidine gluconate, and the second is povidone-iodine. The practice question I used to guide this review is as follows. In patients undergoing surgical procedures, does preoperative skin preparation with chlorhexidine gluconate compared to povidone-iodine reduce the incidence of surgical site infections? This photo depicts a surgical site infection from a recent knee replacement surgery. As you can see, there are signs of infection with edema, erythema, and discharge. Some signs and symptoms that we cannot see in the picture would be foul odor, increased body temperature, warmth, and pain at the surgical site. Surgical site infections are used as a measure of surgical quality and patient safety. They can be easily tracked with acceptable standard definitions across healthcare institutions and research. So, as we monitor rates of surgical site infection, we can evaluate current practice and provide recommendations to guide policy about the use of chlorhexidine gluconate, or also known as CHG. In my literature review, the first study I found was published in the World Journal of Surgery by Dr. Chen and his colleagues in 2020. This was a systematic review and meta-analysis of 30 studies. A systematic review identifies and evaluates all relevant studies on a topic to ensure the conclusions are comprehensive and unbiased. A meta-analysis then uses statistical methods to pool data from those studies, increasing the sample size and the power to detect true effects that individual studies might miss. This statistical combination helps determine whether observed results are consistent across studies and whether differences are likely due to chance, thereby strengthening the statistical significance and reliability of the overall findings. The statistical value that determines if a result is considered significant is the p-value. This value is a threshold set by the researchers and is usually 0.05. If the p-value is less than that number, the result is considered statistically significant. The p-value for this meta-analysis is a much smaller number than 0.05, as you can see. The p-value here was less than 0.00001. and the researchers are confident that the results did not occur randomly. This finding confirms that CHG significantly reduced the rate of surgical site infection over povidone-iodine. The second article I evaluated was from the International Journal of Nursing Studies in 2022. This also was a systematic review and a meta-analysis comparing the effectiveness of CHG to povidone-iodine. CHG was found to consistently outperform povidone-iodine in reducing surgical site infections with a statistically significant p-value. The authors, Dr. Lee and his colleagues, explained that CHG works equally on resistant and non-resistant bacteria, even when it is exposed to bodily fluids. Additionally, because it has an alcohol base, it dries more quickly and is more suitable for clinical practice. A randomized controlled study by Dr. Zahid and colleagues published earlier this year in the Professional Medical Journal showed that from 26 C-section patients that contracted a surgical site infection, 20 of them were from the group on whom povidone-iodine was used for preoperative skin prep, and only 6 were from the CHG group, making a p-value of 0.004. Taken together, these studies all provide strong evidence that CHG is more effective than povidone-iodine in the reduction of surgical site infection. The institutional policy that relates to this topic is Honor Health's policy for antimicrobial antiseptic skin treatment. This policy reflects Honor Health's goal to build trust and partner with others to offer the best care and forge excellent outcomes. Their mission is to improve the health and well-being of those they serve. This particular policy endorses and outlines the appropriate techniques using CHG for preoperative skin preparation. Based on the evidence evaluated for this project, it is recommended that CHG-based antiseptic solution be used as the standard for preoperative skin preparation in all eligible surgical patients. The rationale for this is supported by the multiple high-level studies, randomized controlled studies, systematic reviews, and meta-analyses, demonstrating that CHG significantly reduces the incidence of surgical site infection compared to povidone-iodine. This picture depicts microbes existing on the skin entering the surgical site during surgery. Preoperative skin preparation reduces the bacterial load on the skin at the surgical site. Reducing surgical site infections reduces costs, and preoperative skin preparation with CHG is a safe, cost-effective intervention that will improve patient outcomes. So what does this mean for the nurse? Well, the practice of integrating findings from current research into daily routines increases positive outcomes. As a nurse, it is important to participate in quality improvement initiatives, not only for collecting data, but for improvement in personal practice as well. Understanding the evidence in research behind a particular practice can help you educate your peers and your patients to improve outcomes. The conclusion I have developed from this project is that evidence-based practice ensures not just doing things right, but doing the right things. In the case of Honor Health policy, using CHG for preoperative skin prep is the right thing, and this is supported by the evidence demonstrated by multiple high-level studies. My personal practice of continuing to apply and advocate for evidence-based interventions such as CHG antisepsis supports ongoing quality improvement and patient safety. and makes me a better nurse. Here are my references. Thanks for listening.